Welcome to the Government News Brief for Wednesday, June 22, 2016. In the news, high-level government team visits Region 5, hundreds of Guyanese benefit from CHNPA's 50/50 Jubilee promotion, and government taking steps to eliminate child labor. I am Azim Khan with the details of these and other stories. Stay tuned. Thank you for staying with us. Here now are the details. A ministerial team led by Vice President and Minister of Public Security Kemrat Ramchatan, including Minister within the Ministry of Public Health Dr. Karen Cummings and Minister of Citizenship Winston Felix, this morning visited the flood-affected communities in Region 5 to take a first-hand look at the situation. Here is that report.
The ministerial team, along with technical officers of the Ministry of Public Infrastructure, visited flood-affected communities of Region 5 and engaged its residents. The immediate aim is to drain the water off the land to save farms and livestock, according to Minister Ramchatan. The residents were told that the administration is concerned about the situation and will work with all stakeholders to bring relief as soon as possible. Residents used the opportunity to detail their losses. Inspections on the ground reveal that the backlands are not flooded. Reports from villagers indicate that heavy rainfall experienced in the backland led mainly rice farmers to discharge water from their rice lands and other farmlands into the drainage system, leading to overflow of the drainage canals and flooding in the residential areas. The situation is further compounded with the non-working pump at Trafalgar Village. The outfall channel at Trafalgar Village is also silted up despite being cleared prior to the rainy season. So far, $56 million was spent to effect repairs on the Trafalgar pump. Meanwhile, a team from the Ministry of Public Health was on the ground distributing bleach and treated mosquito nets. Following on-the-ground inspections, the government and technical teams engaged the regional administration and other stakeholders during a boardroom meeting which discussed areas of intervention for the flood-affected communities. The National Drainage and Irrigation Authority, NDIA, has deployed 3 mobile pumps, 6 tractor-operated pumps, and 2 excavators to the West Coast Berbice villages of Golden Grove, Lovely Lass, Trafalgar, Number 29, Union, and Litchfield. 2 of the mobile pumps have been deployed at Trafalgar, while the other is stationed at Bushlot. All these pumps are working, pumping a total of 1,200 gallons of water per second. All 6 of the tractor-operated pumps are also operational in an effort to reduce the floodwater level, while the 2 excavators commenced work on Tuesday afternoon. 2 other pontoon-based excavators are operating to clear the Trafalgar outfall. These pontoon excavators were deployed from the Demerara River. NDIA also has 2 engineers dedicated to monitoring the situation in the area and responding accordingly. Namila Baines-Rowe, Government News Brief.
The Central Housing and Planning Authority's 50/50 Jubilee payment plan benefited over 2,800 house lot owners and also brought in a much-needed liquidity to the CHNPA. More in this report.
Minister within the Ministry of Communities with responsibility for housing, Valerie Sharp-Patterson, says that the agency earned $590 million from the 50/50 initiative. The minister recently spoke to Gina about the success of the initiative.
There were some benefits to this initiative. The first one I can say, direct transfer of wealth of approximately $590 million. That's a huge sum. And it was expected that the initiative will encourage greater occupancy, as I said, and we'll see the expansion of the construction industry, which indeed took place.
According to Minister Sharp-Patterson, close to 3,000 persons took advantage of the initiative to pay off their very low to middle income house lots.
The very low income persons, the house lots that they bought was $59,400. Of course, that was so many years ago. And then we had low income. Those lots were 92,000. We had the moderate income house lots ranging from 150,000 to 300,000. Middle income from 500,000 to 1.2 million, and over 1.2 million the high income.
CHNPA 50/50 Jubilee Initiative was launched in February and ended in early June. It provided for persons who had paid 50% of the cost of their house lot by May 1 to be given a 50% discount on the balance. According to Minister Shar Patterson, not all eligible beneficiaries were able to complete their payment.
I know they had more persons who wanted to. Some persons paid their 50% by April, but just didn't make it for the 50% on their balance. They didn't, some wanted some more time and all that. Although I extended it 2 days.
The Jubilee promotion was held to encourage various allottees to pay for their lots and provide them with savings that they can use towards starting construction of their homes. The promotion was also done to improve the liquidity of CHNPA and to stimulate construction boom in the economy. For the Government News Brief, Seneca Thorne reporting.
The 2014-2015 U.S. Department of Labor report revealed that Guyanese children are engaged in child labor. Now, the coalition government is taking steps to eliminate this practice. Find out how in this report.
Qualified persons are being recruited to staff a unit that will tackle child labor. The unit will be established under the Ministry of Social Protection. Minister Voucher Lawrence says the rights of children are being abused.
I have been speaking over the last 2 meetings with the minister within the Ministry of Labor and the Chief Labor Officer with regards to child labor, because it is prevalent in Guyana. People flaunt this particular aspect of the rights of the child. And you can see them in your view. You go to stores, you go to the marketplaces, you go to the vulcanizers shop, the minibuses and so on. And we have our children who should be in school are out there working. And so we need to address that, and we hope that we can address that very soon, beginning the third quarter.
Additionally, plans are in place to enforce laws that cover child labor, remove working children off the streets, and ensure they are in school, and provide more funding to facilitate labor inspections. In 2015, the ministry released the findings of the 2011 National Child Labor Rapid Assessment Survey. The survey was conducted in Georgetown, New Amsterdam, Linden, Curveton, Blackbush Polder, number 58 Village, Charity, Kukwani, and Aichuni. It found that children and young workers are involved in the worst form of child labor, including prostitution. A 2014 to 2015 U.S. Department of Labor Child Labor Report also found that Guyana's children are engaged in child labor in agriculture and exploitation in commercial sex trade. For the Government News Brief, Seneca Thorne reporting.
The Ministry of Education is pleased to announce that the government's annual school uniform voucher distribution has started. The ministry is ready to distribute approximately 150,000 vouchers to parents and guardians of children attending public schools in regions 2, 3, 4, 5, 6, and 10, and in Bartica and Georgetown. Each voucher is valued at $2,000, an increase from $1,500 in the previous years, and is valid until October 31, 2016. Parents are reminded that vouchers are intended to be used for the purchase of school items only. All vouchers can be redeemed at participating businesses or suppliers. A list is available at the respective schools and regional departments of education and has also been published in the press. A valid form of identification is required to uplift this voucher. Every child attending government school is entitled to uniform assistance under the National Uniform Program. The Ministry of Education administers the Uniform Voucher Program on the coastland, while the Ministry of Indigenous Peoples Affairs caters for the children in hinterland communities. The Civil Defense Commission is setting systems in place for mining communities to be first responders in the event of mining accidents. Details in this report.
Emergency response systems are being set up with the Regional Democratic Councils of Regions 7, 8, and 9 Deputy Director General of the CDC, Kester Craig, says that these systems will prepare the regions to be first responders in the event of a mining-related accident.
At the community level, you'll have what's called CERT teams, what's Community Emergency Response Team. So if something like that happened, first and foremost, you'd have a team with the necessary equipment and resources to go and help to remove the injuries and try to take them to safe location like the hospitals or medical facilities within the region.
The CDC does not work directly with the mining sector, but Craig says that the Commission provides training in risk reduction to sector agencies such as the Guyana Geology and Mines Commission.
So what we do, for instance, in some different time of the year, we bring the stakeholders together and train them in different aspects of disaster risk management, especially when it comes to preparedness and response, and maybe give them general overview on disaster risk management. Secondly, all the plans and policies that are developed, we share it with them so they can review and see how they can incorporate in their program and their mandate.
The CDC also assists the mining sector in developing proper responses to accidents and disasters and advice on resources needed to respond in the event of a disaster. For the Government News Brief, I'm Tiffany Rogers.
Improvements in the public health sector could eliminate the need for hinterland residents traveling to Georgetown for surgeries. Details in this Renetta LaFleur story.
The Ministry of Public Health plans to have all hinterland regional hospitals offer surgical services. Director of Regional Healthcare Services, Dr. K. Shako, says hinterland regional hospitals would be equipped and staffed to provide surgical services.
Lethem Theatre is functional, but Lethem depend on surgical outreach, as well as Mabaruma Hospital depend on surgical outreach. Soon, these hospitals will have their own specialists, right, to function within the various theaters. But as of now, they're still dependent on surgical outreach.
Dr. Shako explained that the aim is to have equal healthcare service provided throughout all the regions.
Currently, one of our plans within the ministry is health system strengthening with a focus on equity and equality in healthcare. Because as you know, healthcare is not equal in Guyana simply because we have the hinterland locations, 1, 7, 8, and 9, and we have the coastland locations.
The surgical theatre at the Bartica Regional Hospital is now functional and will provide orthopedic surgery, obstetrics, and gynecology surgery, among others.
Region 5, the Maikoni Hospital, well, the theatre there is not functional. There are some issues there of which we're currently working on to make that theatre functional.
The West Demerara Regional Hospital and the Linden Hospital Complex provide these services as well, while others will be upgraded shortly. The New Amsterdam and Georgetown Public Hospital's surgical theatres are recognized for the number of surgeries that are carried out at these facilities, and they continue to provide specialist services. Renetta LaFleur for the Government News Brief.
That concludes today's edition of the Government News Brief. The details of these and other stories can be found on our website. Stay updated, subscribe to our website and YouTube channel, and follow us on Facebook. The Government News Brief is a production of GINA. Do join us again tomorrow for another edition of the Government News Brief. Thank you for watching.